Good morning, everyone. I am Dr. Raj Palraj. I'm the Chief Infection Prevention Officer for Armor Health. Thanks for your time today. What I'm going to do is talk about the COVID vaccines available in the United States, how they work, and we can try to answer some frequently asked questions and see if there are any myths that we can bust. What are the learning objectives? We will talk about the two mRNA or the messenger RNA vaccines that are available in the United States. We can briefly touch on the viral vector vaccines that may come in the future and then frequently asked questions. Before we start, we should understand what a remarkable achievement this vaccine development has been. Of all the negative things that happened in 2020, the vaccine development that is highly safe and highly effective against this COVID-19 is a silver lining. It's the best news that we have. And it will go down in history as one of the most remarkable scientific achievements of the century. You can see the timeline on the left. The SARS coronavirus 2 genome was sequenced in mid-January. And within a few weeks, scientists were able to create candidate vaccines that were put into trials. Phase 1 and Phase 2 clinical trials began in April 2020, and they were to make sure that the vaccine is safe when given to healthy volunteers. Phase 2 and 3 clinical trials began in July 2020, where they used large number of volunteer individuals to actually see if it works in the real world, preventing infection. And by mid-December, we have two candidate messenger RNA vaccines that have been approved for emergency use by the US FDA. This is remarkable to have achieved all the phase 1, 2, 3 clinical trials within a year, compared to the other vaccines which have taken decades. For example, mumps, measles vaccine, polio vaccine, hepatitis B vaccine took several decades to bring up a candidate vaccine. And some diseases had to wait for hundreds of years to develop vaccine. So this is a remarkable achievement. People ask whether any safety was compromised, whether any corners were cut, because the vaccines were developed within 1 year. This is one of the common questions that people cite when asked about their hesitancy to get vaccine. We can confidently say that no corners were cut, and all the regular stages of vaccine development, phase 1, phase 2, phase 3, were done in a systematic fashion, and all data is available for everyone to see online. It has been approved by the FDA. It has been reviewed by independent outside panels, including the CDC, European Medicines Agency, the regulatory body for United Kingdom, and several other countries. So we can safely say that no corners were cut and the vaccines are very safe and effective. So this slide is to tell us how we develop a vaccine. So on the left, you can see the coronavirus. It's like a tennis ball. And on the surface, you can see these red spike-like proteins. It's called the spike proteins. And these are the proteins that help the virus to attach to our throat, lungs, and the respiratory tract. And that's how they get a hold of our body and cause infection. So if we can make antibodies, if we can teach our immune system to make antibodies against these spike proteins, then when a person is exposed to the virus, the body will make the antibodies. Antibodies will coat these spike proteins, thus preventing the virus from attaching to our lungs and throat. And this is the rationale or the way the vaccine works. So how do we teach the immune system to make antibodies against this spike protein? There are many ways to do it. The older technologies are like inactivating the virus. You pass the entire virus through heat or chemicals so that it is dead, and then you inject into the person. An example will be a flu vaccine. The other technology is a live attenuated vaccine, where you make the virus very weak and you inject into the person. It will still cause a mild infection, and then the person develops antibodies. An example will be the MMR vaccine or the old shingles, the Zoster vaccine. Or you can just make the spike protein and then inject it. An example will be hepatitis B vaccine or the shingles vaccine. The two vaccines that are approved for emergency use in the United States are mRNA vaccine or the messenger RNA vaccines. So let's see how it works. So what is a messenger RNA? It's a genetic template to make spike protein. So that's all it is. It is not a virus. It is not a live virus. It is not a dead virus. It is not a DNA. All it is a template for making the spike protein, and it's coated in a lipid nanoparticle and injected into the muscle. Once it's injected, it is taken up by the muscle cells and the lymph nodes. And inside these muscle cells and the lymph nodes, our cells use this template, and the ribosomes are our protein manufacturing factory. And they use this mRNA template to make spike protein, and that's all it does. And the spike protein is processed by our immune system so that they learn how to make antibodies. So the next time someone is exposed to the virus, our immune system knows how to make antibodies to the spike protein, and they do it very quickly. The antibodies coat the virus, and the virus cannot attach to our lungs or the throat. So that's how the mRNA works. It is just a template that our own body uses to make spike protein and teach the immune system to make antibodies. So what is the data for these two vaccines? How safe and effective they are? The Pfizer vaccine was studied in approximately 43,548 patients. Patients 16 years or older were included in the study, and they received the vaccine 3 weeks apart. And you can see on the table on the right side that patients who received the vaccine, 8 patients developed symptomatic COVID infection, compared to 162 patients in the placebo group or who didn't receive the vaccine. And in terms of severe COVID infections, in the vaccine group, there was only 1%, whereas in the non-vaccine or the placebo group, there were 9 patients. So 95% effective after the second dose. What about reactions? Most people get mild pain, little bit of swelling and redness at the site of the injection, which is very common. And more than 90% of people say it's very mild. It doesn't affect them at all. What about systemic symptoms? Many people develop fever, muscle ache, joint ache, fatigue, little bit of headache that lasts for about 1 to 2 days. And what are these symptoms? These are signs that the body is responding to the vaccine and the vaccine is making antibodies. These are not unexpected side effects. These are not because of impurities in the vaccine. These are actually good thing, a sign that body recognizes the vaccine and is responding appropriately by making antibodies. So most people should expect some symptoms after the second dose. If you think about it, if after the first dose, you are just introducing the spike protein and the body is just seeing it for the first time. And after the second dose, since the body has already seen the spike protein before, our immune system make the antibodies much more quicker. That's why these fever symptoms are more common after the second dose. Is it unexpected? No, it's a completely normal way the body responds to the vaccines. So this should not discourage people from getting the vaccine. And I have to say that I got the 2 doses of Pfizer vaccine. And the first dose, I didn't have any reaction at all. The second dose, for 1 day, I had mild fever, muscle ache, joint ache. They were mild. I was still able to go to the hospital and work, so it did not affect my day-to-day activities at all. So for most patients, the symptoms will be mild, and if you have it, it's just a sign that your body is actually responding to the vaccine. The Moderna vaccine, again, it's the same mRNA vaccine technology. It was tested in 30,420 patients. Patients who were 18 years or older were included in the trial, and they received two doses 4 weeks apart. And on the right, you can see the table. Among the patients who received the vaccine, there were 11 infections. Whereas in the placebo or who didn't receive the vaccine, there were 185 patients who got infection, and 30 of them had severe COVID infection. And in the vaccine group, none of them had severe COVID infection. This is great news. The vaccine not only prevents people from getting symptomatic COVID infection, it also prevents severe COVID infections. It prevents people from getting severe COVID requiring hospitalization, ICU, ventilator, and so on. So this vaccine is close to 95% effective after the second dose. The side effect profile is very, very similar. Local reaction, pain, swelling, little bit of redness, and everyone should expect to have some low-grade fever and fatigue and myalgia that lasts for about 1 or 2 days, more common after the second dose. So what's the difference between the two vaccines that are available? Both are mRNA vaccine. Both are covered in lipid nanoparticles. Both require two doses. Both are almost 95% effective in preventing people from getting symptomatic COVID infection and severe COVID infection. The side effect profile is also very similar. The only difference between the two is how they are stored. The Pfizer vaccine need to be stored in ultra cold freezers, minus 70 degrees Celsius. So these ultra cold freezers are available in large academic centers and large hospitals. And the Moderna vaccine require only minus 20 degrees Celsius. So these are more feasible in smaller facilities. So what happens to the mRNA? We talked that it's just a template to make the spike protein. It doesn't go into the nucleus of our cells. It does not integrate or affect our DNA at all. It does not affect our genetic code. It is not a live virus, so it doesn't multiply inside our body. It cannot cause the disease. It cannot cause the infection. It degrades itself very quickly within 8 to 10 hours after the injection. So after 10 hours, it's no longer noticeable in the body at all. And the spike protein lasts for 2 to 3 days. So after the vaccine, the only long-lasting effect is our immune system is able to make antibodies against the spike protein. Is the COVID vaccine safe? That's a very good question. That's one of the common questions that people have in surveys, what they are concerned about the vaccine. What we can say is we have shown that more than 70,000 people in these two studies were included, and they did not have any serious side effects. And so far, almost 50 million people in the entire world have received these vaccines. In the US itself, more than 20 million people have been vaccinated, and they have been very safe so far. Only a handful of allergic reactions have been reported, 1 to 2 people per million. And these are more common among those who already have a history of allergic reaction. Most of them carry EpiPen with them, and that's why before you get the vaccine, they will ask you whether you have any history of anaphylaxis or whether you carry EpiPen for any reason. If you do, then they will take extra precautions. They will monitor you for at least 30 minutes in the center, and all the vaccine centers will be equipped to manage any allergic reaction. They carry EpiPen on site. It is free from animal tissue. It is not made on animal tissue. It is not made in eggs. It is not made in fetal tissue. It is a completely cell-free process. So these two vaccines are very, very safe and pure. How effective are the vaccines? They are 95% effective in preventing symptomatic infection, and it prevents severe infection. Both require 2 doses. How long will it protect you? All we know that the vaccines are good for 3 months. And why we say 3 months? Because The vaccines were approved in December, and we have had 3 months of time to know for sure that they're good for 3 months. But we can safely say they are at least good for 1 year. Can those who had COVID infection get vaccinated? Absolutely. It's perfectly safe to get COVID vaccine, and it is strongly encouraged to get vaccinated. Why? Because many COVID infections have mild infections or asymptomatic infection. And we know those people who have had mild or asymptomatic infection, their antibodies don't last long. And we have seen cases where they got reinfected. So the response the vaccines provide or the protection the vaccines provide is much stronger and long lasting than the mild or asymptomatic COVID infection. Can you get the COVID vaccine with along with other vaccines, for example, flu vaccine? Absolutely. It's perfectly safe to get vaccinated for both COVID and the flu at the same time or within a few days or within a few weeks. Do you still need to wear a face mask? I think yes. Why do we say you still need to wear face mask? Because it prevents you from getting sick, preventing you from getting admitted to the hospital. But there might be a little bit of viral infection in the throat or the nose, and we may pass it on to the others who are not yet vaccinated, who are not yet protected. So it is more for other people's safety that we still have to wear the face mask. Once the 70 to 80% of our population get vaccinated, then we may stop wearing face masks. So it is very important that we encourage everybody in the community to get vaccinated so that we can all go back to normalcy, go back to stop wearing face masks and do our social activities without restrictions. Is the COVID vaccine safe in older people or people with autoimmune diseases or people with cancer, people with immunosuppression? Absolutely yes. Both vaccines are mRNA vaccines. They are not live vaccines. So they are absolutely safe to get vaccinated for people with a weak immune system or cancer or taking steroids or autoimmune diseases. We talked about eggs. The COVID vaccines are not made in eggs. For example, the flu vaccine is made in eggs. The COVID vaccine is just created in the lab. So people with egg allergy can take the COVID vaccines. Can COVID vaccines cause infertility? There is a lot of misinformation online about the COVID vaccines. And we know for sure that the COVID vaccines cannot cause infertility. It is not scientifically possible. And we know that the millions of COVID infections in the world, it has not affected pregnant women in a serious way. It has not caused any problems with the child as well. You can remember the Zika virus and how it affected pregnancy and caused malformation. But the COVID vaccines and COVID infection does not affect pregnant women. COVID vaccines do not contain any microchip tracking or nanotransducers. It is important to kind of educate your friends and people in the community because you are healthcare workers, you have more medical knowledge, and it is important that you educate your friends and family. Does COVID vaccine alter the DNA? Absolutely not. These are messenger RNA vaccines. They're just template that our body uses to make the spike protein. It cannot enter the nucleus and it does not alter our DNA in any way. And that messenger RNA just disintegrates itself within 8 to 10 hours. COVID vaccines are made in the lab using chemicals. They are not made using fetal tissue at all. They are not live viruses, so they don't need to be grown in eggs or fetal tissue or animal tissue. So these COVID vaccines are pure mRNA vaccines and they do not contain any cells. Let's briefly touch on the viral vector vaccines. The Oxford AstraZeneca vaccine, it is a viral vector vaccines. What do I mean by the viral vector vaccine? They use a chimpanzee adenovirus and introduce the genetic code to make the spike protein. So the virus is just a vector, a vehicle to introduce the uh, genetic material to produce vaccine. They do not cause disease. These viruses cannot multiply inside our body. It's given in two doses and it is approximately 70 to 90% effective. The vaccine have been approved in the UK and many other countries in the world. They have not been approved in the USA, so we don't have to worry about it much right now. So what other vaccines are available in the near future? We talked about the Oxford vaccine, the viral vector vaccine that may come in the near future. And there are two other vaccines that might be available in the United States soon. One is a viral vector vaccine developed by Janssen Pharmaceutical using a weak adenovirus 26. So these viruses introduce the genetic material to produce the spike protein. They cannot multiply and they cannot cause disease. And the Novax vaccine is another one that shows promise. It is a protein subunit. All it contains is the spike protein and it's not a live virus. It is indeed a viral vector. More to come on these vaccines once they are published in the near future. So let's briefly touch on the UK variant and the South Africa variant. What are these variants? As the virus replicates and spreads around in the community, they mutate. They constantly change. And in the UK, they have noticed that a new variant have been circulating widely and replacing the old strain of the virus. This UK variant appears to be more transmissible. It is able to spread from one person to the other much quicker. It has replaced almost 60% of the infections in the United Kingdom, and it has been spotted in many states in the US. And it is expected that within a month, this UK variant or the fast spreading variant is likely to be the predominant strain. The good news is our vaccines are able to control this UK variant, and our treatment regimen, the remdesivir and the antibodies, are able to control this UK variant. The only thing is this variant is able to spread much quickly. So before it gets a hold in the US, we should encourage people to get vaccinated. And as I said before, the viruses constantly mutate, and there are thousands of mutations already documented. And most of them don't have any effect on the virus, but few mutations, especially on the spike protein, changes the ability of the virus to spread quickly. And that's what has happened in the UK variant. And the same is true of the South Africa variant and the Brazil variant. Before these mutant strains change, we have to get vaccinated. Vaccine is our best protection against these UK variants. Vaccine provides stronger protection against this UK variant than natural infection. So that's another reason for people who had mild infection or asymptomatic infection to get vaccinated, because vaccine provides protection against these variants. So I will stop with this. So what I would like to conclude is we have two vaccines, Pfizer vaccine and Moderna vaccine, that have been authorized by the FDA for emergency use. These are messenger RNA vaccine, just a template for making spike protein. They do not cause disease. They are not live vaccines. Everyone should expect some mild low-grade fever and muscle ache after the second dose. That's normal. It's a sign that vaccine is working, but you will still be able to work and the symptoms disappear after a couple of days. Vaccine is the only one that will protect us against these mutant variant strains. Vaccines will be the only tool to get back to normalcy. We need to encourage people. 70 to 80% of the population needs to get vaccinated before we can take off our mask and do our social interactions without any restrictions. So I would encourage all of you to kind of educate your friends and family to get vaccinated. Thank you.